Okay, let's continue our discussion of fiber today. Fiber is the hot topic of nutrition these days. So yesterday we talked about fibers. We said fibers were complex carbohydrates that humans couldn't digest, but our bacteria had the potential to ferment them. So traditionally, fibers are thought of as roughage, if you will. So people have a concept of fibers just being something that helps you pass your bowel movements as a bulk forming agent. And that's true in certain fibers, but fiber can really be thought of as more of like wine. There's just all kinds of different characteristics to different fibers. So just like wine, you have red wine, white wine, dry wine, sweet wine. Some wines go better with certain foods. Fibers can be thought of as the same way. Different fibers do different things. Fibers have different properties. They can be very different. So the three main properties of fiber are solubility. Does it dissolve in water or does it not dissolve in water? Is it viscous or bulking, or is it not viscous or bulking? And can it be fermented? Can our bacteria break it down into byproducts? So different fibers have different solubility, fermentability, and viscosity characteristics, and they do different things in our body. So take cellulose, for example. So cellulose, which is probably the most common fiber that we eat, cellulose and hemicellulose. So cellulose is not soluble, does not dissolve in water. It is not fermentable or minimally fermentable, and it's bulking. So a fiber like cellulose, we would give to people with, say, trouble passing bowel movements or constipation. That would be a great fiber for them. Insoluble, not fermentable, bulking. So if you want a fiber to slow digestion, say, and decrease glucose surges or insulin surges, then psyllium might be a good choice. Psyllium is partially soluble, it partially dissolves in water, it's partially fermentable, bacteria can ferment some of it, and it's gel-like. So psyllium becomes a gel in your body, and that gel slows absorption and decreases glucose surges and decreases insulin surges, also helps decrease cholesterol. So that would be psyllium. Then you could take a fiber like, say, wheat dextrin or inulin. Those two fibers are almost 100% soluble. They dissolve readily in water. They are almost 100% fermentable. Our bacteria can break those down and create all kinds of short-chain fatty acids and a diverse, robust microbiome. And those fibers are not viscous forming. So fibers like inulin or resistant starch are used for, they do different things in our body. They're very useful for things that are different than what cellulose or psyllium does. So a good fiber product would be a product that combines a lot of different properties, so it does a range of different things in your system. So I happen to like Relievance fiber. That's a fiber that I worked on, I consulted on. And Relievance fiber is a great combination of 8 different fibers. It's an 8-fiber blend that has both soluble, insoluble fibers, and fibers with various viscosities and fermentabilities. So it does a lot of different things. So I happen to like that particular fiber. Just a disclaimer for Relievance, the statements on the label have not been evaluated by the Food and Drug Administration, and Relievance fiber is not intended to cure, prevent, diagnose, or treat any disease. But if you're looking for a good fiber, that's a good, well-rounded fiber blend. It also has no preservatives, no additives, no sugar, and no flavors. It's just pure fiber. So that's kind of my follow-up on fiber today. Think of different fibers like you might think of different wines. Different fibers do different things, and we as physicians try to tailor the fiber to the person's condition. So I hope that's helpful for you. As always, like and follow, ask your questions and comments, and I'll do the best I can to answer them. Thank you.